Dear friends, welcome to the second World SDG Forum webinar that we hope to make into a series scheduled for 11 a.m. on every last Saturday of the month. The first webinar, in partnership with the Wildlife Vertical of C20 and RIS, discussed the concept of the World SDG Forum and tried to formulate a strategy for the way forward. The seminar affirmed the relevance of the WSF and provided the following pointers for a way forward. Leverage the global perception change regarding India, reflected very well in India's G20 presidency to drive the global conversation on SDGs and beyond. The Prime Minister in America has also been emphasizing this. We must evolve WSF as a global collective to accelerate the achievement of SDGs, which can happen only when interventions happen on the ground and are not confined to expert level dialogues. Expand the set of interlocutors for the WSF seminars with greater representation and participation of international partners such as the UN, World Bank, and other multilateral organizations. Sustain outreach to embassies, permanent missions, and diaspora to bring in more and more SDG interventions and practitioners from across the globe. Maintain the momentum with regular webinars and seminars focused on accelerating SDGs, leading to the third International Conference on SDGs in Chitrakoot on 27th February 2024. Partner with more organizations, national and international, working on SDG solutions and capacity building. This webinar, Partnerships for Development, is a progression of the theme. With this, I hand over to our esteemed moderator, Dr. Suraj Kumar. Suraj has immense experience in the development space with UNDP, has written a book on SDGs, Social Development, Sustainable Development Goals in South Asia. He is currently Chief Advisor to KISS, the Kalinga Institute of Social Sciences. It's all yours.
Yeah. Thank you, Vasant, and welcome on in Delhi, a humid Saturday, but the conversation will be very fertile. We'll just quickly get going. The order of the speakers. First, we will have Mr. Amit Lahiri, who will speak. He's joining us. He's already joined us from the University of Waterloo in Canada, and he will speak on. He will provide a historical overview of 3 decades of partnerships for development. Then we have Ms. Ratnamala Kapoor, who's working in Uttarakhand, bringing quality health care, through her foundation, Village Based Charitable Trust. We have Mr. Digvijay Chaudhary, who is a qualified engineer, trained at UT Austin, and he runs the Fields Foundation, which is a global network of alumni from the Indian Institute of Technology who work on sustainability and related issues. Then we have with us Mr. Shambi Sharp, who is the UN Resident Coordinator, highly distinguished international civil servant, and an expert on a very important topic. He's worked on HIV/AIDS in Europe, and that has earlier been a passion of mine when I was at UNDP. So we are very privileged to have Mr. Shambi Sharp. The order of the way it's gonna work, guys, is as follows. I will invite each speaker, provide a brief introduction to them, and then the speaker will have 8 to 10 minutes to sort of deliver their initial intervention. Then we will, each speaker, based on their topic, would have to field a few questions, and based on the response, we will move to the next speaker, and so on and so forth. And at the conclusion of the various speeches, we will have the keynote by Mr. Shah, followed by an initial Q&A. And we are very privileged to have Mr. Sameer Sharma, who's Chief Executive to the Chief Minister of Andhra, who would share some insights on how do you upscale and replicate okay, good practices in SDGs so that we are able to generate the momentum on SDGs that has been hampered by conflict and pandemic. And at the end, we will sort of have a provide a brief summary and a vote of thanks by yours truly. With that, I would like to invite Mr. Amit Lahiri, who is a PhD candidate at the University of Waterloo. And prior to that, he's a trained molecular biologist and a molecular biologist working on sustainability and environment is a very important topic. Mr. Lahiri has also been the Chief Sustainability Officer at the Jindal Global University. So he brings a wealth of experience and diverse perspective on the topic. Amit is joining us from Canada. It's a bit early in the morning. We will, that's why he's the first one up to bat. Amit, can you please sort of take it over from here?
Sure, Dr. Suraj Kumar. Thank you very much for the very generous and kind introduction. And I mean, although it's whichever way you interpret it, it's 1:30 in the on Friday night or 1:30 in the morning on Saturday in Waterloo in Canada. But it's such a pleasure. Despite the time, it's such a pleasure to be in the midst of such a distinguished audience and very honorable, and esteemed friends. So I'm Amit, and quite late in my career, I I'm trying to concretize my long-term aspiration of doing a PhD, which for some reason or the other, over my 30-year career, I haven't had the opportunity and the time to basically pursue, in spite of the fact that, I mean, I did find the opportunity and the time to complete, pursue and complete about the 3 master's degrees. So one was in molecular biology, um, at the University of Mumbai. At that particular point in time, it was Bombay. Earlier to that, I was a student of life sciences and organic chemistry in St. Xavier's College in Bombay. Subsequently, I did protein chemistry and protein folding. And then I worked actually in industry out of the 30 years, for the bulk of the first decade of the 30 years. I worked for 2 multinational companies. One was a German and the other one was a French, Sanofi Pasteur. And I worked actually using my expertise in protein folding to look at how enzymes can be used as a marker for infectious disease testing, which is probably all of you know that it became the focus of attention during the COVID pandemic over the last 2 or 3 years. Testing was absolutely at the core. So that is what I've, dedicated myself with these 2 multinational companies and had a variety of postings from Germany to France to the Middle East and back to India as the country manager of Sanofi Pasteur, the clinical diagnostics unit. So I transitioned from R&D to commercialization of technologies and diagnostic technologies. And that was quite a long sweep. And I was very much at the center of economic globalization, as I observed at very close quarters in my first decade in industry from 1989 to 1998. And then there was a kind of a interesting transition. I came to York University in Canada to do my master's, my second master's. And this is the first time that I actually studied the social sciences. So it was on sustainable development, and that was the first time ever in 1989, the beginning of 90s, that I started acquainting myself with this language of the social sciences to understand development in a global historical sense. And that led to a third master's in in a business school, the Shodik School of Business, quite well known in training MBAs in sustainability. One of the 10, I think, top listed Forbes top listed business schools specializing in sustainability, also in Canada, also at York University. And that led me to change for the next 2 decades of my career in academia. So the first 17, 18 years of um, the 2 decades in the Canadian colleges system, the colleges and polytechniques, uh, and then the remaining as chief sustainability officer when I relocated back to India, to my own country of birth, with Jindal Global University as the first chief sustainability officer, laying the foundation of sustainable development for the whole university, such and working with various schools and teaching and developing curriculum, and also doing community university partnership and engagement, and defining the role, the language as to how sustainable development and SDG, Sustainable Development Goals, could be incorporated within an academic framework. So that brings us to that's 2017 to 2021, and then of course it was the pandemic, and then I thought that I will take a leave of absence from the university, and looking at the whole world turn upside down, as all of us have seen, I thought that maybe this is a good opportunity to give long-term aspiration, to do a doctoral program. And here I am at the University of Waterloo, uh, which, by the way, I don't know if you know, uh, was the university which commercialized the first smartphone in the world, the BlackBerry. And this was actually within the University of Waterloo, the Research in Motion, the company, which still exists. And of course, BlackBerry was made famous by President Barack Obama when he used that during his presidential campaign in 2009. So it's known to be a highly innovative university, often called the MIT and Stanford of Canada. And it is obviously science and technology led. It's engineering school and computer science school, and now robotics and artificial intelligence is one of the foremost in the world. And the Department of Environment is the largest, actually, one of the largest in North America and the largest in Canada. And within that, I'm positioned at the School of Environment, Enterprise and Development. It's also called SEED, which is an interesting acronym. And here we try and understand how sustainability science interacts with the language of social and economic development. And in this context, I'm supposed to be talking. I'm supposed to be talking about partnerships for development, and in that context, partnerships for development. How do SDGs, and in particular corporate partnerships, particularly in India, the 2013 quite unique legislation on CSR, how that could facilitate partnerships and development of partnerships through the CSR, as I've experienced it, particularly when I relocated to India and working with Jindal Global University. So I'll take you through very quickly, and Vasanji and Dr. Kumar, please be the judge of my time. So minus my introduction, I will
You have
try to
5 minutes.
confine my. I've got 5
You have
minutes.
5 minutes.
Okay, all right. So very quickly, you know, I think a very important point that I want to make is that the definition of sustainable development in everybody's mind is always that trying to meet the present needs while ensuring the future generations can meet their need. But I think in the same paragraph, the emphasis should be more, and I read, environment is where we all live, and development is what we all do in attempting to improve our lot within that abode of environment. The two are inseparable. Humanity has the ability to make development sustainable. So I think this is in the same paragraph that I feel as a PhD scholar that the definition should have emphasized this inseparability between human development and the environment, which is not emphasized enough. And that leads me directly to the language of the SDGs, which obviously evolved and transitioned from the language of the Millennium Development Goals in 2000. And in 2015, 193 countries ratified this goal of 17 goals with 169 targets and 247 indicators in order to measure the progress of these targets. And the most important thing that stands out in connection with what I just read out in the Brundtland Commission, that what should have been emphasized is the inseparability of the environment from development, is that this is a systems view of an integrated vision of trying to combine human development, which includes economic development, within the limits, ecological limits of the earth. And that is a long conversation which started off at the Club of Rome in 1972, limits to growth. And that, of course, got formalized through the science of ecological economics, largely defined by Herman Daly. And Rockstorm, in his legendary 2009 paper, The Planetary Boundaries, actually gives and demonstrates scientific evidence and proof that the Earth indeed has limits, and economic growth cannot cross those limits. And so I think the language of the SDGs is very important to understand that this is a systems view which integrates social and economic development within the sphere, limited sphere, which is the geosphere, the biosphere, and the atmosphere. And this is where, we come to this whole notion of climate change and how we have basically extracted and how we have wasted beyond the limits. And using Rockstorm's scientific framework of 9 planetary boundaries, we have already crossed 3. Biodiversity depleted by almost by about 70%. And then we talk about of course, the climate change, which, has, the warming of the surface of the earth and the oceans and the catastrophic consequences, and therefore the target of that net zero by 2030 and trying to limit it within 2 degrees, 1.5 to 2 degrees, where the hope is exceedingly small now. And it is considered that over the next 3 years, there'll be increasing frequency at which human civilization and industrial civilization would possibly cross multiple times with greater frequency than 1.5 degrees. And so within this context, the language of the SDGs become very, very significant, right? Because we are trying to look at this triple crisis of the climate change, the biodiversity loss, and pollution, which is one of the most important existential crises, within which we come to talk about partnerships and talking about the language of SDGs, right? The last SDG 17, but I think it should be positioned at the center, and it is graphically positioned at the center. That is on partnerships. And within the context of India, this unique legislation, which sparked off in 2013, this a corporate social responsibility mandated for a particular group of companies making profit above a certain level. Now it has extended, it's been extended into I think 1,000 companies having to mandatorily report on the sustainability in the National Stock Exchange, and so that's a very, very welcome. But I think what I observed, particularly when I relocated after a long stint in Canada in 2017 to Jindal Global University, and I was closely studying the scenario and also partnering with the Ministry of Corporate Affairs on trying to use the language of the Sustainable Development SDGs to as a way to measure the impact of India's CSR legislation.
Amit,
Right?
we would have to.
So in this particular,
Can we wrap
yes,
up in a
so
minute or so, please?
I'll wrap up in a minute. Absolutely, a minute or two, I'll wrap up. So in this particular context, from 2017 to 2021, um, through numerous partnerships, with the Tata Institute of Social Sciences, which was designated as the National CSR Hub, we organized the first conference. And then India's Sustainability Standards Conference, which was the Center for Responsible Business in Delhi, a very respectable NGO. Jindal Global University partnered with them and with the Schulich School of Business, where I had done my third master's, and with the Copenhagen School of Business and with the Aston School of Business in the UK. And we tried to sort of define this framework of how SDGs and CSR could work simultaneously as a signature in India's legislation. And then, of course, so I'd like to basically conclude here that I think what stood out from all these partnerships and all this experience was that I think the CSR, the biggest potential in India was for the first time the collaboration and the partnership between the development sector and the corporate sector and the industry, which had never really come together. And this is where I think the compromised language of sustainable development, that neither is it complete economic growth at the expense of the environment, and nor is it human development at the expense of the environment, but somehow integrating human and social development and economic growth within the limits, as I said earlier, that science has now demonstrated that we must live within the limits of the three spheres, the ecosphere, the atmosphere, and the biosphere of the Earth. So I think this is the biggest promise, in my opinion, that this collaboration, I think, can really, really go and make India an iconic sort of country in the map, a global map of SDGs. And that's where I'd like to end. Thank you so much for your patience.
Thanks, Amit, for your intervention and for sharing with us your life journey as well as a thoroughgoing critique, okay, of the manner in which, okay, CSR has looked at, okay, the entire issue of sustainability and highlighting again the importance of sustainable human development. Years ago, the Tata Group did a Tata Human Development Business Model. I think many of those initiatives need to be re-examined, and let's see which is the best way to go forward. Maybe we need to leverage the SEBI to ensure, okay, that the reports that get submitted by the top companies are also examined for content and follow up as distinct from the tick marking. It is my pleasure now to invite Ratnal Kapoor, okay, who is sort of an inspirational civil society leader. He is the founder and managing trustee of Village Waste Charitable Trust and has extensive experience in the healthcare sector. And she has a great passion for bringing the healthcare sector to the communities. She's worked a lot on telemedicine And I mean, especially Mr. Sharp, since you have an experience and interest and you have published on public health, this intervention might be, very inspirational for all of us. Ratmala ji, over to you. Please begin your presentation. You have 10 minutes since we've given about 15 to our friend Amit. So I'm just increasing the timeline to 10 minutes for the other speakers.
That's fine. Thank you very much, Suraj, for the very sweet and kind introduction. And really, thank you to Vasant for even thinking of inviting me to speak to everybody. It's such a delight. And I'll be talking on Village Waste Charitable Trust and on our work here. So we are a trust, which is a non-government organization, which was founded in 2008. Over these past 12 years, Village Waste Charitable Trust has been consistently working to change health-related behaviors through interventions on health education and then through telehealthcare model in very remote and rural areas of Uttarakhand. Out of our experience, we evolved a unique and convergent model, which we call the Tulsi Rural Healthcare Initiative. This initiative rolls out the Tulsi Network, which is a preventive healthcare program based on community-led volunteers to spread community-wide awareness about preventive care. And then layering into this and building upon this increased knowledge within the villagers and their health-seeking behavior improving, we bring in the telemedicine solutions for primary health care. So this is basically what we've been doing these last 12 years, and it's really been interesting and a lovely journey. But some of the really difficulties or the challenges that we've encountered is because we work in mountain areas. So we find that the topography is very challenging. It's high mountain areas, and it comes with its challenges. Doctors, we've noticed, prefer to live in cities and towns, and so they very rarely actually want to come up to these village areas and support the community. And so usually all the government PHCs and CHCs are empty, devoid of very good healthcare at all, no healthcare. And also the population of this, yeah.
Ratmala, if you want to forward your presentation, the controls are with you, or you cannot tell me and I will keep forwarding it. See on the first slide.
1 second. Is it not? Am I audible? Like, can you hear me?
Yes, no, it's only I've put up your first slide. If you want me to forward the slides, let me know, or you can do it yourself.
Okay. I think it's fine, Vasant. I think I'm managing. If everyone can hear me, that's good, right?
Yeah, that's
so
totally audible.
Okay. So basically what we find is the population. Have you got my other slides? You can put them up if you wish, Vasant.
You tell
have
me
them with you. Okay. So Vasant, now I'm on page 3.
Done.
Slide 3. So this is basically that you see these are the various challenges that mountain areas have, and it's just lack of connectivity. It's really remote and scarce villages dotted on the mountainside. Between the villages, even there's very bad roads. I mean, there aren't any roads, and each village in itself, which I find is very sparsely populated. Some villages will have just 200 people. But I mean, at the end of the day, is what I said was, is it that we don't reach them? Obviously not. Every human life matters, right? So basically what we're about is, what Village Waste Charitable Trust tries to do is to bridge this gap. We're trying to reach the unreached. And so over the years, we've come across what has worked for us, and we think it should work for others, and we feel it's really scalable, is a solution which brings in preventive healthcare and then layers in the telehealthcare. And so this is a convergent kind of model. And why I say that preventive healthcare is really important in these villages is because the basic village, remote village human being doesn't know what good health is. They don't know what nutritious food is. And so actually, if you build in and make a good field uh, of knowledge within the area, then at least they know what good health is about, and then they start seeking healthcare as well. And so this is really a convergent model that we're trying to do, where we work on preventive healthcare, and after that we bring in the telehealthcare model, which works really well for them. And how we bring the preventive healthcare model is that we actually work with the community, and we have community conversations, we have project awareness, we form health committees, and we identify the needs of the community. We mobilize volunteers as peer health educators, and these are from within the village. We do very comprehensive training of master trainers and the volunteers, the peer health educators. And each peer health educator looks after about 10 or 20 households to implement the program. And actually, what's really lovely about this program is that because these villages are so remote and sparsely populated, they're quite close to each other. So their own social relationship is quite strong. So when we build a Tulsi Didi from within the village, she already knows the people, and they're willing to listen to her with her knowledge. And we leverage this social relationship of theirs and to create an awareness on preventive healthcare. And she gives knowledge to each household, and she's been living there for 20 years. And so basically, when the program ends, let's say in a year and a half, there's a repository of knowledge within the village on what good health is all about. And it never really leaves. So this is something that we have thoroughly enjoyed doing, which is the preventive healthcare program. And then over and above that, we find that with this, they actually need a doctor. And since no doctor comes to the village, we started a telehealth program. And it's worked extremely well. We train the Tulsi Didi from within the village. And these are centralized Tulsi telehealthcare e-clinics. Attached to them are mobile community health desks at the village level. They're all affiliated with e-clinic. Home-based care is given. Referral of cases is done in these villages. Monitoring of chronic illnesses is done. We buffer this with having specialty health camps. We do number of screenings, like within the government primary schools, any colleges that there might be, the sub-centers. And another very useful point that comes in with this is we link the people with the various government health-related schemes because they don't seem to know them. And also it creates a kind of advocacy because when we link them into the government-related schemes, they're aware that they're there. And we also help them get a voice to make sure that they get the benefit of the schemes which are available actually, but usually don't reach these last mile villages. In the while I speak about the telehealthcare program, it's actually just it's like a hub where you have a room in a village where there's connectivity. But beyond this are villages. These are those twinkling lights in mountains that you see when you're there at night. They're really far-flung villages. And we want to reach the last mile and really to fulfill Village Ways Charitable Trust mission to bring healthcare to the last mile population. Regular community health desk programs are organized where the Tulsi Didi takes a backpack on her back, and it has diagnostic equipment and a tablet so she can connect with the doctor. And here she reaches on foot to remote villages and sets up a desk. Here she connects patients living in these very, very remote mountain areas with doctors at a back end through a web-based communication system. She provides screening tests. She provides health education to the patients. And so this unique initiative has tremendously helped vulnerable groups having limited mobility due to several reasons, such as old and the infirm, women, especially pregnant, lactating mothers, and also very busy women who are working in their fields, and so they lack quality primary healthcare, and this community health test really helps them. So I think this is really one of the jewels in our program, where we can connect really the remotest of villages to doctors. Here we were using our own software and connected to CSR doctors, a panel of CSR doctors. Simultaneously, we thought that we should also try working with eSanjeevani, which is the government health program, telehealth program. And so right here, I'm actually talking about the Tulsi Healthcare Model A, as we've called it. It's a collaborative approach for sustainability by working with the government in these remote areas. So what we do is that Village Ways Charitable Trust recruits and trains local youth, and also we provide a backpack of medical equipment, portable and diagnostics, cutting edge in technology. I mean, we even have a lovely ECG machine, which is 12 lead, fits on the palm of your hand. And these Tulsi Didis can actually take an ECG at the remotest area, and it's converted into PDF on their tablet and goes to a doctor anywhere in the world. So I think it's just magnificent, you know, that you can give top of the line treatment to a patient in a remote mountain area. And this is what Village Ways Trust does. And what the government brings is the telemedicine software. They have a panel of doctors, an enormous panel of doctors, and their physical infrastructure. So they have various sub-centers and PHCs in all these areas. Whether they're working or not is besides the point. They have physical infrastructure. So what it is that with resources brought by the trust and the government, we create e-centers, e-health centers, and we establish it in the CHC or the PHC or a sub-center in a village. And it is operated by the Tulsi Didi, the health assistant who is trained. And she provides an array of healthcare services to these remote populations. What she specifically provides is teleconsultation, where she connects a patient to the doctor via eSanjeevani telemedicine software. And the patients receive medicine from the government health facility based on their e-prescription. She also has diagnostics. So primary diagnostics such as BP, temperature, pulse oxygen saturation, weights, heights. Also provides screening for common NCDs, diabetes, hypertension, heart diseases, with all the superb equipment that is available today, portable equipment. At the same time, there is health education. So we orient patients to follow treatment protocols for timely recovery, which is really critical in these areas. We conduct outreach at schools and community level, that is on preventive and promotive healthcare. So I think this kind of works really well as a sustainable model, and I'd encourage everybody else who's trying to create healthcare in last mile villages to work with this. It's worked for us. We're happy to share and talk to people about how we've gone about it. So what is really our value addition to the government model? So basically, the government facilities, I found that, you know, there are challenges where their infrastructure is concerned. There's a scarcity of doctors. There's a scarcity of paramedical staff. There's no training in telehealth with their staff. There's a lack of trust from the villagers. Now, what do? We station our trained Tulsi Didis to support and train the PHC and village level government staff, that is the paramedics, the ANMs, the ASHAs, the Anganwadis, in telemedicine software. We provide mobile clinic equipment and backpacks of superior quality to serve villagers at their doorstep. So together,
in the next minute, please.
Yeah, will do. So we work with the government to enhance, certainly. We work with the government to enhance and maintain the infrastructure and the quality of care, integrating telemedicine. So basically, really to end, I would say that these are the advantages of Tulsi Rural Healthcare Initiative. We skill youth in the remotest of areas. So it just kills a Tulsi Didi and also generates livelihood in these remote areas. It promotes good health by enabling easy access to healthcare services, telemedicine as viable and sustainable channel. It demystifies telemedicine in these areas as a powerful and sustainable tool to access timely and quality healthcare service. It reinvigorates healthcare for the community level by integrating telemedicine. It also contributes to economic stability of the community, and special focus by Tulsi Didi to increase awareness, follow correct treatment protocol for good health, and reduce recurrence of illness, that is ensuring intake of correct dosage of antibiotic medicine, completion of course to avoid antibiotic resistance and such. So we have various testimonials, and it's really quite heartwarming to say that if you do an integrated approach of a preventive healthcare and a telehealthcare, and if we actually combine our telehealthcare in possibly with the government, it is remarkable as to the amount of good health initiative that can be created in these very, very difficult terrains. And so that's about it from me. Thank you.
Thanks a lot, Ratna. It's a very good example of how do you look at people's health in people's hands. And for me, it was especially enlightening to see how grassroots intervention, okay, in a remote mountain area, okay, is also addressing issues pertaining to antimicrobial resistance, which thus far is confined to conversations mostly at the policy level on One Health. So thanks a lot for this intervention. And it is my pleasure now to invite Mr. Digvijay Chaudhary.
Hold on, Suraj. Can we have a discussion, please?
All right. So,
yeah,
I mean, maybe we
got
can have 2 minutes.
Yeah. We'll have a speaker and a discussion, and then we'll go forward. So,
all right.
Let's just keep to the format that we had agreed upon. So,
sure. Actually,
yes, Vasan.
You know, your Tulsi Didis, do they have any basic qualifications that you'll ask for? Do they need to be 10 standard pass, or is there just any woman who's kind of in the village who's keen to do this, or how do you work?
No, we have a very specific protocol list for Tulsi Didis. They have to be class 12 pass. They have to be 18 years of age. And usually we prefer if they've studied science in school in their 11th and 12th.
Okay, yeah. That I was just interested
to
know
that is
part, you know.
Yeah, it's kind of important, you know, that they're class 12 and they're 18 years of age. There's a certain amount of maturity also required. And the way we train them, actually, which hasn't been specified here, is with there are two styles. One is we work with Sector Skill Council of the government, and it's a 6-month health assistant course. It's really fabulous. So these girls are trained for 6 months with the Sector Skill Council. And after that, they go for a 1 month to a district hospital level for hands-on training. And then they go back to their village. So we really invest deeply in the Tulsi Didi. And I must say that they are very strong members of their society, and they're shy and reticent when they start. But by the time they're finished a year or 2 years later, they're really wonderful to meet them because they are very confident young ladies.
So we have a program in our villages called Samaj Shilpi Dampati, where we have a graduate couple that live and work in the village. You know, perhaps we can have a conversation with you later and see how our Didi of the couple can also become a Tulsi Didi. Yes, so we'll have this
would be lovely, Vasan. I would love that. Thank you.
Yeah.
We'll definitely talk post the forum. Thank you.
Dr. Satish, I think you wanted to say something?
Yeah. It's a very, very laudable, experiment which is being carried out by Ratmala there in the Uttarakhand. My only concern is that the fundamental concepts which NGOs try to bring to reality, they work. But the same concept, same ideas, when practiced by the public sector fails. Now, what I was thinking was that if you have really to achieve SDG goals, or especially in the area of infant mortality, maternal mortality reduction,
Yes.
I think possibly we have to rope in government more strongly.
Yes.
Primary healthcare is fine, but now the challenge is how you are going to reduce, say, neonatal mortality, and you can't do that unless you have very strong referral linkage. Right?
Very strong. Yeah, absolutely.
You can't have referral services provided unless government specialists, the government healthcare system is also roped in. So my question is, number one, how much population is being covered in this program, the Tulsi program? Number two, what are the areas where you try to say involve government, and to what extent you have been successful? For example, how many cases, how many, for example, conduction of delivery in remote areas, preventive care is fine, but conduction of childbirth will definitely need midwifery care, which has to be mobilized through the government system. So my question is, what mechanism of actions you are putting in place to really,
make changes, to really bring changes?
That's very, very important. Now, the concept of primary healthcare should also change now. The comprehensive healthcare component invariably involves the component of referral care, because the messages of primary healthcare, they become standard, they become more credible if they are also reinforced by the specialists sitting at the tertiary care center. So what are the ways by which you are involving specialists in the government system? So I get very disturbed, because some of these programs, which are identically, philosophically very much, the same with the government, but then they don't work. So we have a responsibility to find out why the government programs are not working, why the ASHAs are not working, why the outreach sessions organized by the Urban Health Mission, they are not functional in Uttarakhand. So these are the questions which I will just pose before this audience, and maybe I will not be able to provide answers, but let's collectively try and seek answers. Otherwise, it's so difficult to achieve SDGs.
Yes. Well, thank you, Satish. These are really such, actually, these are the challenges which are really faced before all of us. So to begin with, I'll tell you, originally what we thought was that, we'll just carry on with as I had mentioned earlier, a private model of having our own software, which somebody had kindly, and back-end doctors, private doctors. But this is not the way that you can achieve sustainability. At least I don't think so, because I particularly work, not me, but the whole trust works in remote rural areas. And we found that if we don't actually activate the e-Sanjeevani, even basic primary health care of a cold or a cough goes unnoticed by these villagers, because they don't have anybody to turn to. All the let's say the PHCs and the sub-centers in these various areas are absolutely, I would be scared to use this word, but they are defunct. And so what happens is that when we have been able to tie up with e-Sanjeevani to roll out a program with them, let's say in an area, then we straight away have 7 centers. See, they have scale. They can straight away give you 7 centers to roll out their program. As a private NGO, if you try to do it, you'll find that you can set up 1 unit, 2 units, because otherwise it's just not physically possible. But here you have infrastructure by the government in every nook and corner of these remote areas, but they're empty. So if you tie up with the government as a base, you have to start somewhere. So if you tie up with the government as a base and you start rolling out e-Sanjeevani, you are training the, let's say the ANM, the ASHA, in how to use the e-Sanjeevani, making sure that it's working. And of course, Satish ji, what you find is that when they are given, let's say they get a prescription, more than usually that medicine will not be available at this remote PHC or sub-center. So what happens is, so it fails. So you have to
keep this more focused. This is a very long conversation. So
but yes,
fascinating topic. we have
Yes,
one hand up, which is Dr. Suresh. I would
Yeah.
request Dr. Suresh if he could make his intervention during the Q&A segment, and so that we can move ahead with the rest of the program.
Yes.
With due apologies to all the participants.
Let just intervene here, because what he does is connected to what Ratnamala does. If we can keep these two together, it will be very good.
So
Suresh,
yeah, so we have a quick, short intervention, and then I promise we'll get back to this fascinating conversation during the Q&A. So Suresh ji, you have 2 minutes.
Suresh?
So, I think he's in listen and speak mode. So maybe we'll get back to him.
I'd already made him a speaker.
Yeah, am I audible?
Yes, you are.
Yeah. So like the same Tulsi Didi, as you know, Vasanti, we have and Samaj Shilpi Dampatya, we have introduced this Swasthya Rakshak Dampatya in Palghar district tribal area. And I'm working last 2 years, and similar difficulties as Ratnamala has specified. Government sector, nothing is available, that we are also facing the same thing. But our idea is that to create a model, like we are working in 30 villages spread over in Palghar tribal area, and our Dampate, as like this Tulsi Didi, they are the community participation is amazing. We have also given them diagnostic kit and trained them, and they are going door to door getting the health data. And the recent development is that we have developed a digitalized health locket. So that locket is a wearable and it contains a QR code. So whatever data entry done by the Dampatya, that can be easily available by scanning the QR code through the locket. So whenever they wear this locket, so we give the locket having this digital information. So basic thing is that there is no data on health, especially in tribal areas, even though they talk about so many apps like Ayushman and the other. But so that's what we are trying now. So what I wanted to say is we as a NGO can develop a model, but ultimately the government has to accept it and run it effectively. That's the idea. Thank you.
So this whole idea behind all these webinars is, the title says it all, partnership development. So we need to see how we can build this platform so that we can nudge the conversation. All of us at World SDG Forum don't expect to change the narrative, but what we are trying to do is nudge it slightly so that what we are doing on the ground can influence and help motivate government schemes and policies, and scale through that. So we'll, I'll put you all both in touch, Ratnamala, with Suresh, and both Satish and Suresh, and we can go forward. Yeah, Suraj, I can back to you. Suraj, back to you.
We now move to the next speaker, Mr. Digvijay Chaudhary, who is a highly qualified technocrat and also sort of leading light when it comes to moving from the tech segment to the social benefits segment. And he's a leading social entrepreneur who currently runs this outfit named as Sobus Insight Forum. Sobus, I assume, stands for social business. It is an idea initiated by Professor Muhammad Yunus, but it has caught on like wildfire. And I would like Mr. Chaudhary to share both his experiences as well as offer some insights as to how do we sort of, build and strengthen partnerships or development so that good initiatives can be replicated and upscaled. Okay, that becomes very, very important. How do we connect various good interventions on SDGs? I invite Mr. Digvijay to take over the floor. Sir, you have 10 minutes, following which we will have a quick set of questions for you. And then we move on to the keynote address by Mr. Sharp. So Digvijay, over to you.
Digvijay, you need to unmute.
Okay, quick check. Can you hear me clearly now?
G. Let me know when you want me to
Namaste.
display your slide.
Yes. So namaste everyone. I will try and stick to the 10 minutes. You quick 2 to 3 minutes of context setting and sharing about how to build these partnerships which can really scale the SDGs is what we will dive into via one of the interventions of Wheels. So one quick overview of Wheels Global Foundation. It is an IIT alumni initiative where IITians who have succeeded the world over feel that they want to give back to India, especially towards rural development and integrated rural development. And that's why this the movement has come together. And I'm the president in India, and there are many wonderful IITians and IITians involved in this initiative. We have an India branch also, and I'm the president of that. My personal background, IIT Bombay, electrical engineering, BTech, masters from UT Austin, Texas, worked in the Bay Area, returned back, and I complete 20 years being a volunteer full-time with the Art of Living Foundation in Bangalore, and ended up running a lot of their large projects. And out of all of those experiences, the culmination was starting with the corporate, then moving to a pure NGO model. There are great things in both the models, but neither of them can ensure scale with sustainability. That is where the idea of social business comes in, and that is the organization SOBUS that I run now. Getting onto the SDGs, one clear thing that has emerged is the SDGs form a global path for human growth and progress in a way that it respects people and planet. So that's the way we look at SDGs. And on one side, for the planet, we are at the time of maximum abundance. Life has never been so comfortable. The access to resources, facilities, technology, this is mind-boggling what has happened. At the same time, and this is the irony, we also have the maximum inequality and the biggest number of crises that are hitting the planet, whether it is planetary boundaries, whether it is a loss of biodiversity, climate change. We are seeing the effects of it. So one underlying
Digvijay ji, we've lost you.
Digvijay, can you connect again? Vasant, one thing that we could do, with your permission.
Digvijay ji, we've lost you.
Hello.
Yes, we had lost you.
Yeah, I think we have lost him. Do we wait for him to reconnect, or do we invite the keynote speaker, Mr. Shah?
Just a moment. Suraj, we've got till 1 o'clock.
Yeah, I know.
Just hold on for a minute. Let's see if he can get him back.
Sure.
Digvijay, we can't hear you.
Hello.
Yeah, we couldn't hear you. I don't know how to message him. No,
Vasant, I would suggest that we move to the keynote. When Digvijay joins, we'll give him a slot in the post. We can do
that.
Yeah. So I think, as I said, technology remains a challenge. SDG 17 has specific targets on tech, and we look forward to having Digvijay join us shortly. It's given me now great pleasure to invite Mr. Shambhi Shah, who has more than 25 years in promoting inclusive and sustainable development. And he now leads the UN system in India, working on SDGs and sustainability, etc. Without further ado, I invite Mr. Sharp to deliver his keynote address. Over to you, Sam.
Okay. Thank you. Am I audible?
Yes, you are.
Yeah.
Very well.
Okay. Thank you very much, Dr. Kumar and Vasant and colleagues. Namaskar, good morning or good evening, as the case may be. It's a real pleasure to join this conversation, the World SDG Forum. Great to see that this has become a sort of a series of webinars. And really, bringing together civil society, academia, government for the SDGs, and very much appreciate DRI and RIS for bringing us together across such, an impressive range of diverse silos and geographies. I think the title of the discussion today, Partnerships for Development, really captures the DNA of success, the all hands on deck approach. And I think listening to the previous speakers has really been a great journey, a deep dive to the very grassroots, reaching the last mile in terms of health and the bigger picture, talking about the concept of sustainable development itself. I'm reminded of heard somebody once say that this old kind of adage that if you want to go broad, you go with government. If you want to go deep, you go with civil society. If you want to go fast, you go with business, and if you want to go far, you go, all together. So I think that's really been the spirit of the conversation, and something that we need more than ever before in this time of polycrisis, as Amit, first speaker, was talking about. For the very first time, we see a world in which, as we approach this sort of the midterm to 2030, not only are we not making progress at the pace that we should be in many areas, but we're actually falling backwards, being pushed backwards in many respects. The latest, so I'll kind of come a bit, I guess, more from the bigger picture, looking at the global trends, and then speak a little bit about India's important role in all of that. So the SG's Advanced 2023 report on SDG attainment is finding that a number of SDGs are severely off track. Only about 12% of the goals seem to be on track. Nearly half are moderately or severely off track. 1/3 almost have seen no movement or have actually regressed to 2015 baseline. So with current trends, we see almost 600 million people will still be living in extreme poverty by 2030. Only about 1/3 of the countries will meet their targets to have national poverty levels. The world is back at hunger levels not seen since 2005. Food prices remain high. Something like almost 350 million people are newly facing acute food insecurities. And as was mentioned already before, this very small and shrinking window to achieve the 1.5 degrees centigrade limits is closing rapidly. At current trends, by 2030, almost 700 million people will still be without electricity. 2 billion people cooking with polluting cooking fuels and such. So the lack of progress and the challenges to progress, this is universal, but the developing countries and poorer communities are truly bearing the brunt of our sort of collective failure to address, especially crises. Recently emerged this triple planetary crisis, this polycrisis. And unfortunately, the gulf between the resources that we need and the investments being made not only isn't lessening, but it's increasing as we move forward. So the annual SDG financing gap has now reached, according to estimates, $4 trillion and continues to rise. Now, as the UN Secretary General Antonio Guterres said when he was here in India, in Mumbai, just towards the end of last year, the SDGs are in need of urgent rescue. There are definitely some points of good news to note. Internationally, we've seen the world coming together with some really important milestones. The historic Montreal Global Biodiversity and Framework Agreement at the COP15, global agreement to protect biodiversity and end plastic pollution, the establishment of the Intergovernmental Negotiating Committee at the UN Environment Assembly, which has been tasked to develop a global treaty on plastic waste. The High Seas Treaty, which was recently agreed after a decade of negotiations, placing about a third of the seas into protected areas by 2030, and a historic agreement to protect marine wildlife and ecosystems outside of the special economic zones. And then also a point of optimism from my view, and something we've been discussing already today, and that is India. Now, of course, as we know, the world's largest democracy, one of the fastest, if not the fastest, growing large economies, more young minds, the greatest youth generation to tap in history. No country has had so many young minds. India is uniquely positioned to help lead response. And again, as the Secretary General mentioned in Mumbai, India is perhaps the single country that can best help make the 2030 agenda a reality. For one, something like upwards of half of some of the global targets are here in India, need to be achieved here in India through the partnerships that we've already been talking about today. And India's growing position as a provider of development solutions to other countries, also an important trend. We've seen some really, truly impressive achievements here on achieving the SDGs at scale in India, near universal electrification during the last decade, improvements in food security, resilience, the targeted public distribution system, being able to respond to increased needs during the COVID pandemic, for example. A truly astounding increase, 400% increase in renewables capacity in less than a decade. Solar has increased 11 times in just 5 years. Investment in solar, $200 billion being committed by the Indian business and private sector. We look at water, sanitation, Swachh Bharat, Jal Jeevan, national missions delivering tremendous gains for hundreds of millions of people. Digital transformations, the digital public goods infrastructure. India truly is kind of a global leader on the cutting edge of that, delivering financial inclusion, for example, especially for women in particular, all driven by the Indian stack of digital public infrastructure. I think I would also mention that one thing impressed upon me when I arrived in India just over a year and a half ago was the degree to which India has embraced the SDGs as a kind of a conceptual framework, and the localization of SDGs across the board, really aligning well with this concept of cooperative, maybe competitive federalism at times. We have the India SDG Index, which has been providing data to governments. I've had the opportunity to engage in a lot of state-level discussions with planning commissions and such about, really looking at how do we achieve better progress across all sorts of health and social and educational indicators. And then, of course, the truly important role of civil society. We've heard already quite a bit today. How important the partnership is between governments, between civil society, between businesses, and civil society India is no exception, remained a partner of choice for many of our UN agencies and in their interventions. Civil society provides unparalleled research reach and has trust at the community level, on the ground, at the grassroots. Truly important, and this is something that's really integrated within the UN Secretary General's our common agenda. So it's recognized globally that to achieve peace and security, full respect and enjoyment of human rights, that we need this truly vibrant civil society ecosystem working together with governments, with the international community, with business as well. So, colleagues, I think just to mention 4 of the urgent key actions and priorities that the Secretary General has highlighted in the latest report. First of all, recommitting to accelerating action for the next 7 years. We're at the midway, with halftime, so to speak. So we really need to raise our ambition. This includes reform and overhauling of the international financial and economic systems to respond to today's challenges. As we all know, much of the architecture was designed for the world as it looked like in the mid to late 1940s. So we need ambitious political declaration and specific commitments brought by countries, India included, to the SDG summit in September towards later this year. Secondly, we need integrated and targeted policies to eradicate poverty, reduce inequality, end this war on nature, as the Secretary General calls it, with a particular focus on advancing the rights of women and girls. And I think here India has not only an incredible demographic dividend potential for the next several decades, but also an incredible gender dividend potential if that is done right. And then, of course, climate action, climate justice, which is really an important point that India is bringing to the international fora, are truly critical there. Thirdly, strengthening not just the national but subnational capacities. And here, as we've heard today, continuing to empower local governments is truly important in India with the federal structure and strong states and lots of programs being unleashed. And we have the aspirational districts programs, Niti Aayog working on that as well, are truly important. And then finally, the Secretary General has called for an SDG stimulus, calling for $500 billion a year between now and 2030 to help countries tackle debt distress, scale up the development bank lending, and expand and strengthen the ability of countries to have access to contingency funding when crisis strikes. So these are all important. Here, I would like to mention quickly India's G20 presidency at the moment, which has really gone far to put the SDGs and SDG acceleration at the top table of global geopolitical conversation at the moment, advancing the 2030 agenda. So we've really felt a great alignment, excuse me, with India's presidency. In fact, I'm often calling it an SDG 20 because it's so well aligned to the priorities and the goals, and thanks to India's presidency, to the Secretariat, and all of the different line ministries engaged in that for that. And we've had the UN system here has been working closely in many aspects of partnership with India's G20 presidency across the ministries at the Sherpa and Secretariat level as well. And I think the timing of India's G20 presidency and bringing these messages is both important because the world is in polycrisis, but also because we are at this midterm, this stock take. And so there will be literally a handshake. India's G20 presidency, the Leaders Summit concludes 9th and 10th of September. And then literally just a few days later, we go into the World Comes Together for the SDG Summit at the General Assembly in New York. And India is bringing to that table some really important outcomes. The SDG Acceleration Action Plan is vitally important. The lifestyles for environment outcome as well, and a number of other important outcomes India will be bringing to the table at that summit just a few days after the conclusion of the presidency. So colleagues, I'll stop there, but just to say that incredibly important moment in time and history, and it's very I would say exciting to be working at this moment here in India at this very time because of so much that is happening. So many challenges remain. There's no doubt about that. But there's so much momentum moving forward. It's a real honor and privilege to be here. And again, just to note that the Secretary General identified, India really does have, is uniquely positioned to be a key player in bringing together countries across so many of the divides that we see today, north, south, east, west, you name it. India is bringing a lot of trust and political will and demonstrated solutions at scale, and some of which we've been discussing today to help us move forward at this important time. Thank you very much. Bahut dhanyavad.
Thank you, Mr. Sharp. Are there any questions for Mr. Sharp?
I'd just like to, Mr. Sharp, just say one thing. I mean, you didn't take the top, you did the headline of the report, which was promise and peril. The promise is in peril. And, the whole, I think we sort of thought that the promise was in peril a little earlier than the Secretary General's report. And that's why we were trying to create this platform where all of us can come together. And the whole focus of our conversation is the acceleration of the achievement of SDGs. I think Dr. Chari is with us as well. And Dr. Chari is a great motivator for us to take this whole program forward, because as Ratnamala said, the Indian context where we try to use community-based resources in the SDG achievement of SDG goals is something that we have to offer the world. We are all doing it in different manners, but we all seem to have identified that working within and identifying resource within the community is the key to acceleration of our goals. So, this is a lesson that perhaps can be taken up and expanded upon. And, so this was the whole idea behind this platform. And I think, it's quite timely. Yes, Sanjay? You need to unmute.
Can you hear me?
Yes. Yes.
Yeah, good afternoon, everyone. I just wanted to say thanks first to the team for getting all the best people on the globe. I had only two things to add to Ratnamala's Tulsi task which she has taken. One is just to add to reach the unreachable. We have been now in kind of new dimension of drone delivery that can be done in mountains of drug in the immediate way. And second thing which we are doing here in Satna is training the students in mountaineering.
We seem to have lost Dr. Maheshwari. Dr. Maheshwari is the director of the Birla Hospital in Satna and has a lot of rural experience. Suraj, you can take it forward. Anybody's got anything else?
Yeah. So, first of all, as a erstwhile member of the Resident Coordinator's Office, I'm really pleased that we have strong leadership from the UN, and we do hope and we wish all power to the UNRC's elbow, okay, at keeping the flock together and getting the momentum to accelerate the SDGs. The point that he has made has also been well initiated in the 2023 Development Working Group, agenda action plan for SDGs, which is a logical build-up agenda, recognizing the reality and essentially what the promise in peril document, okay, it emphasizes 4 things, which is purpose, solidarity, ingenuity, and technology. That is what bailed the world out in the aftermath of World War II. And it is our expectation that since the UN has also been bookended by pandemic and by conflict, we are able to build on these 4 principles. I would now like to invite questions from the audience or interventions from the audience. Samir, if you're there, Dr. Samir Sharma, Chief Executive to the Chief Minister of Andhra Pradesh, may I invite you to share with us the insights from the field in upscaling and replicating and accelerating the progress on SDGs. Samir, over to you.
Thank you, Suraj. Thank you very much. Good afternoon to all of you. And you know what I'll be talking is the main points that come out today. Mr. Sharp spoke about SDG action plan, upscaling, and then the local efforts of Tulsi by Ratnamala ji. What Amit ji talked to us, you know, about the 3 E's and how to integrate that, Digvijay ji. And now in Andhra, I am the Chief Executive Chief Minister on SDGs. You could say something like a Chief Sustainability Officer. And I focus for the Honorable CM only on SDGs. Now I'll be just taking 3 to 4 minutes on how we adopted, localized, and we monitor the SDGs. We understood that there was no way of business as usual. If we continue like this, we are going to miss the 2030 target. And the most important thing we realized was upscaling it. So how did we upscale it? We upscaled it, and we call this the policy as top-down and bottom-up. It consists of general elements as well as specific elements to take care of the contextual needs of villages. Now, what did we do? First, we had the goals. We made a state indicator framework with 475 indicators. Then, from the 475, we listed 115 indicators which the Niti Aayog and Government of India is giving priority to, and we started focusing on this. These 115, we found 61 were indicators in which if we took some action at the village and district level, it would have an impact on the SDGs. So we focused on the 61. Within the 61, we found 20 priority indicators where a performance was not likely to enable us to reach the 2030 target. Now, these priority indicators, then we focused on 8 indicators that are relating to education, health, largely education and health. And they are focused on anemia, malnutrition, and dropouts. Now, this was the strategy or the policy we did. Then, when we came down, we mapped each and every scheme to an indicator. In turn, we took out the scheme components, and each and every scheme was mapped to a village functionary. And what would that functionary do in relation to the number which we gave a face, in the sense of a pregnant woman was a number up to now, but we gave a face at the level of the village. Next, we have a concept called consistent rhythms. We found that the biggest challenge was coordination. One is, of course, making the Anganwadi workers, Asha workers work, but it was about coordination amongst them. So we used digital technology to its utmost to bring about complete coordination between the various functionaries. We use app-based systems in which we get information directly and doesn't come through the channel of, the blocks, the mandals in Andhra and the districts and upstairs. So this we use to bring them together, bring about coherence, remove fragmentation, sharing of information, as well as sharing of the actions made at the local level. So these are the strategy and plan of action. Next, what we did, there are some, what I would say, transformative structural changes. In each village now, we have a village and ward secretariat with 10 secretaries. Village means for a population of 2,000. We have a agriculture center for 2,000. We have a village clinic. We have, of course, a school and Anganwadi integrated, and we have a digital library, thinking that, work from home and digitalization has to sort of spread out into the villages. Then last 10 months, we have trained right up to village level secretaries using digital means. And the initial training was as we have one-way classroom, but now it is largely bespoke and do-it-yourself training. They go and they sort of learn, and they get into a problem, they come back to us and we do. Based on this, now let me pick up one indicator to just give you an example. Let us take up pregnant women who are anemic. So we have a system where the testing is done every month. It comes onto the app. The moment the testing is done, automatically back and it becomes severe, moderate, or mild anemia. And after that, there's an intervention to be done by the Anganwadi worker, the Asha worker, the ANM. So these interventions are, like giving hot cooked food or take home rations, giving the iron tablets. Plus, we have in the village and ward secretariat a schedule where secretaries who are not involved in this go talk to these women and come. Next to this is the concept of village doctors. We have recruited nearly 48,000 health personnel. We have mandals, which is roughly 1/3 the size of a block. Each mandal has 2 doctors now. PHC has 2 doctors. These doctors go around, they've been given villages, and they go around this village and ward secretariat, and they visit at least once a 15 according to the schedule. When they go there, in addition to sitting in the village clinic, they personally go and look after the severely and moderately anemic pregnant women. Now, if every month on month the testing shows no improvement, then we go into the e-Sanjeevani and the digital means to go to the district level, talk to the medical college and nutrition people what is happening. And that is where our self-help groups enter to help these families, in terms of the nutrition, why is the iron not getting absorbed? And the purpose is that before the 7th or 8th or 9th month, there should be no pregnant women who should have anemia. So this is how we follow. So there is these apps. So the moment a pregnant case is reported, it is populated by the ANM, and everybody gets to know, all the people who have a role in intervention or who have a role of going and talking to the woman, or the people who have to supply all this stuff, including the village doctor. The village, the family doctor, we call them, is the key person in all this, because 2,000 families, they're supposed to know them by name. And we have the entire digital records of all these women. So we try to make sure that before that critical period of 4, 5, 6, 7 months pregnancy, all of them move out of the anemic range. And we also monitor the progress. If somebody has got a blood count of 7, then has it going to 8, 9. So every month we are sort of able to intervene specifically for a woman and design something customized for her. And of course, the last recourse is, if nothing is working, a blood transfusion, which is rare, but ultimately we want no woman to deliver who is anemic. Similarly, we have the other 7 dropouts. Each and every child, the moment they enter school, we track them up to class 12 plus. We have a lot of people dropping out after 8th and 10th. Then we have all these village secretaries going to them to ensure that they're not getting married. Why have they dropped out? Some don't want to study. Then we look at alternate schooling for them. And after 10th, we bring them into the skill system, and we have the ITIs. So this is how we draw. Then the next is about school infrastructure. We have a large program, and the infrastructure is being built. Then we particularly focus on girl toilets. Then we have malnutrition under 5, stunting under 5. And we have anemia in teenage girls between 11 and 18. These are the 8 priority indicators we focus on. So focused approach, localized approach, complete connection there, bringing everybody together, real-time monitoring, making changes based on the feedback from the monitoring, looking after those particular cases which are the sort of, you can say, tough nuts which are not responding to whatever we are trying to give them. This is the entire strategy. Thank you, Suraj.
Okay. Thanks, Samir, for your intervention, which certainly covered the 4 points mentioned in the Promise in Peril document of the Secretary General, which is purpose, solidarity, ingenuity, and technology. We look forward to continued engagement on SDGs interventions with various participants here. First of all, the floor is right now open for Q&As, and anyone who feels that either they have not been given much time earlier, or whether they feel that they have fresh perspectives to add. I invite them to sort of take the floor and inform so that we can give them we can unmute that. We have a raised hand from Dr. Satish, and I think Dr. Sanjeev Maheshwari was to join, but I think he got disconnected. But anyway, anyone from the audience they wish to sort of address, then they just let us know and we'll give them access. Vasant? Hello? I'm inviting Mr. Tejinder Sandhu to sort of make his intervention, please.
Because it's much more a comment. First of all, I'd like to compliment Ratnamala ji for her very inspiring presentation. It brought out many of the key things I think that a good partnership should bring out: the intersection between government, between the NGO sector, the accessing of CSR. There was also one point I think which he did not make, which is that whatever gains could have been made sectorally have been made, and it is because governments are not able to reach out that these partnerships through NGOs accessing technologies. So a lot of the work I think that we need to do in the future around attainment of SDGs probably is going to be around some of the themes that she highlighted around partnerships, around the involvement of CSR funding, getting different energy streams to focus on a particular goal. I also liked very much the innovative solutions that she mentioned, so many of them, which come through the development of a partnership if we are to make progress. I was grateful to Mr. Sharp for highlighting so many of the challenges that we face. Again, none of these challenges could be met by anyone singly, by any government, no matter how powerful, no matter how big, such as the one in India, just by sheer weight of population and all of that. It's going to need partnerships. Perhaps I think a future task for those of us who are working in the organization of these webinars would be to showcase good examples of accountability by all partners, not just by government, as Dr. Satish was pointing out. I want to make one last point, which struck me both in Ratnamala's presentation as well as in the intervention that was made in her presentation by Dr. Suresh, and that is around the role of capacity building. We seem to be finding a lot of technology-based solutions, and we also think that adequate financing would go a long way, both of which are true. But if we don't invest significantly on capacities of people who are actual service deliverers or duty bearers, and more generally on investment in human development within society, we are going to fall short of achieving our targets in 2030. Thank you, Suraj. That'll be it from me.
Thanks, Tejinder. We have...
no, please. If there's anybody from the audience who would, the attendees who would like to have a view or say something, if you just raise your hand, I will give you access to the mic and the video so that you can also join the conversation. That's fine then. Sorry, Suraj. Thank you. I leave it to you.
Before I sort of invite Dr. Chari to deliver the valedictory conclusion. Yes, it is true that while some speakers went ahead of time, and as Vasant has reminded me, I tried to move the piece along. We have 20 minutes. We look forward to Dr. Chari's intervention and also his gracious summary of today's conversation and some insights on how do we move forward here. Dr. Chari needs no introduction. He is a distinguished author, journalist, man of public affairs. He is on the board of the RIS, and he's also been one of the moving spirits behind the Chitrakoot Declaration for the World SDG Forum, which we refer to as the WSF. In addition, okay, he has also led the conversation within the G20 side events pertaining to SDGs. I invite Dr. Chari to kindly make his intervention.
Thank you, Dr. Suraj Kumar, and thanks to Shri Pandit. Thanks to everyone who has participated in this meeting. Sometimes I feel there is a well-known saying in Punjabi, or even Haryana uses it, "Jo bole so kunda kole." So this applies to me the most as of now, I think. It was a casual suggestion that I made that every last Saturday we should be able to hold some sort of a seminar or come together, meet, and discuss certain issues. I never expected that our dear Vasant Pandit would make me sit through this thing and diligently ask me to present a subject every month. But I must admit, we started off with two things basically. One was the idea that our philosopher guide Nanaji Deshmukh had told us. Nanaji had given a prescription that whatever we do has to have three aspects. Number one is involve the people. For any global problem, find a local solution. So to find a local solution, involve the people. The second was, he used to always suggest that share your experience. And the third was, do something which you will be able to replicate. If we look at all that we have heard in the last 2 hours, basically confirms to what Nanaji has always told us. The first thing is that what we have now come to is SDGs are a global agenda. But it is not that the SDG problems are there only for a particular set of people or a particular area. We all know that SDGs basically concern the whole humanity, which India has always been saying. Vasudhaiva Kutumbakam is the idea that we are propagating even under G20. But it is not that it is, Vasudhaiva Kutumbakam is not only for G20, we have been saying it for ages, for centuries. So we look at the world as a family. Now, as a family, every individual may have certain strengths and certain weaknesses. So what we do is, we collect all the strength and the family presents itself as one strong unit and finds a solution for individual problems. the problems of the individual is not limited only to the individual, but the entire family. It becomes a problem of the entire family. Similarly, the achievements of one individual in a family becomes the achievement of the entire family. Like if a boy scores first in, say, a class or an examination, the whole family celebrates. It's not that just only the person celebrates. Similarly, if a girl is getting married, the entire family celebrates. It's not that it is one girl's getting married. The whole family celebrates. Similarly, if somebody is sick, the entire family comes together, feels the pain of the person. So this is the idea that India has given to the world. But at the same time, what we insist, as Nanaji used to always say, that find a local solution. Now, poverty, elimination of poverty may be a global problem, but we cannot solve the problem of poverty in Africa while India remains poor. If your neighbor is poor and if you think only of Africa, you are not going to solve that issue. Therefore, try and find a solution locally, number one. Number two, involve the people. Don't expect that the government should do everything. Nanaji used to always comment saying that even if you are taking money from the government, take only for 1 year. I was the editor of Organizer, and we had some event for which the government was giving us money. So I said, why can't government institute some sort of some system wherein every year the government will give this kind of money? So when Nanaji came to know about it, he called me. He said, no, don't write like this. Don't expect the government to support you every year. Once is okay, but not always. You should be able to stand on your own feet. Go to the people, tell the people, solve their problem, and then make a collective effort. And that is why he chose a place like Chitrakoot. And we have, in our group, we have decided that we will always make Chitrakoot an example of solutions. But we never say that Chitrakoot is the ultimate solution. We always say that every individual, as we have seen today, everyone who spoke about their experiments is absolutely great and fantastic experiments. And in their own way, they are conducting something that probably even a place like Chitrakoot and so many other people have to learn. I was listening to the story which Sandhu mentioned about Madam Kapoor, who is working in Uttaranchal, remote village of Uttaranchal. I have been in charge of Uttaranchal for a long time, so I know how difficult it is to approach villages in Uttaranchal and how difficult it is to solve the issues of those villages. But it's a fantastic work that we are doing. So I think this is the second issue that Nanaji always used to insist, that whatever we do, involve the people and make experiments, learn experiments, and share your experiments, share your experiences, share your solutions, share your problems. So sharing is the second thing that he always used to insist. And the third one, of course, was the replication. What was done in Uttaranchal, can it not be replicated in a village in Tamil Nadu? Maybe Tamil Nadu is closer to the sea and Uttaranchal is closer to the mountains. Geography may differ, but people are the same. People's problems are the same. People's outlook are the same. People's aspirations are the same. So we can replicate all these things. And that is the main idea of this group, which comes to work together. Sometime back, in fact, in the RIS, we had a one day, a few hours of function, which was basically something to do with the OECD report. The OECD has come out with a report. It's called Bottlenecks to Access SDG Funds for Developing Countries. Now, this report was being made for the last 2 years, and the Government of India, of course, RIS is part of the Ministry of External Affairs, but we have got the Finance Ministry, Commerce Ministry, Science and Technology Ministry, all secretaries are ex officio members of our board. I'm the only non-governmental member and a permanent member from that point of view. So we were asked to contribute to this report. And one of the major contributions that we made was what we learned from Nanaji and his experiments in Chitrakoot. So we could bring in all these issues into the report. And this report was released last week in RAS office. So while releasing the report, two issues came up. One was that no government, a national government or an international agency, can fund the entire world to complete all the 17 goals. No government can do, no institution can do. So ultimately, it is the local people, stakeholders, and non-governmental organizations and individuals, collectively and individually, will have to come together and find a solution. This, the report says in 2023, what Nanaji said 50 years back. So the position that Nanaji took and the position that we have taken has been vindicated. The second is, the report specifically mentions that although by 2023, we have to complete what we call the SDGs. SDGs, I'm not being pessimistic, but all the 17 goals of SDGs cannot be completed exactly by 2030. MDGs could not be completed by 2015. So I don't see any reason why SDGs will be easily completed. But there is nothing to worry about it. SDGs are just a direction in which we have to move. Not only the country, but the entire world has to move. And the world has to move in the direction in a collective manner. But however much we call a collective manner, the collective procedures also has to have a leadership. And I feel that India has to be a natural leader of the future of SDG. So from that point of view, we had suggested that we should form something on the lines of World Economic Forum. We should form something like the World SDG Forum, which will continue. What will continue is not the problems. What will continue is not poverty. What will continue is not inadequacy. What will continue is the effort to find a solution to human problems, the effort to treat the entire world as a family, the effort to find a local solution to a global problem, the effort to find people and stakeholders working with the grassroots and suggesting these experiments, and the efforts to share these experiments and experiences not only with other groups in India, but also to the world. So World SDG Forum has to be the platform for all these things. And all of us should read the report. We will try and upload the report also in our groups. The report exactly mentions that we need to come and think as one world, one globe, one issue, one problem. Of course, I did not elaborate on this issue too further because we had so many other people also sitting there. We have to do a lot of homework as far as these things are concerned. So I'm extremely glad that this idea of sharing our experiences has caught up with us, and the partnerships for development is one of the fantastic ideas that friend Pandit had thought of. We will continue with this. We will have more partners, more discussions, more debates, more sharing of experience, and we will go few more steps towards achieving our goal as what Nanaji has outlined for us. With this, my humble thanks to all of you. I sincerely believe that this group has a very, very long agenda and very far to go. Thank you very much, Surajji. Thank you.
Suraj, you're muted.
Vasan Bhaiya, can I say something?
Yeah, please.
Yes, of course.
Thank you, everyone. Great, really lovely listening to everyone. I really love the idea about getting SEBI and such other bodies, like maybe Singapore Stock Exchange or other such exchanges, to put more weightage on companies that would have ESG actual impact. Another thing Nanaji taught us was creating sustainable businesses, which meant, environmentally and conscious for future generations. So therefore, I think businesses have to change because they're the largest probably polluters in the world anyway. So I really like the idea, and I'd love to sort of take that discussion further with whoever from this group, Suraj and Vasanji. And I know some of the stock exchanges personally myself. I think it's a great idea, and there should be more emphasis on that, so that because private sector is probably the largest polluter. Thank you.
Thanks, Aditya, for the great thought. It is true that financial markets, need to be part of the solution rather than part of the problem. I think there are some good initiatives underway, both the SEBI directive to the top 500 listed companies to submit their sustainability reports on a mandatory basis. And also now we have the social stock exchange. That is an idea that has been mooted. How do you sort of, raise, and that also links with the Addis Ababa Action Agenda document. Tejinder has his hands up. Before we wrap up, Tejinder, over to you.
No, but we'll have a chat about that, Surajji, later. But if you listen to Shambe, Mr. Sharp earlier, there's a still $4 trillion delta deficit. So, we really need to utilize that money for the improvement of the globe. Sorry, sir.
No, certainly. I think the UN resident coordinators has brought into, if I may use the word, sharp relief the speed of the challenge before us. I invite Tejinder to make a quick intervention before we wrap up.
Yeah, just 30 seconds to flag that there is something that the Bangkok Stock Exchange did many years ago with UNICEF, whereby I think they took a penny off every transaction. So it might be useful to study if, something like that could be done for creating an SDG fund. Thank you.
Yeah. Okay. Thank you, everybody, for your time.
More sustainable.
We'll call this
SDG fund, but anyway, we'll talk about that offline. Sorry. Yeah. Sorry.
Let's call this a day. Yeah. All right. Thank you, everybody, for participating, and I'll be in touch with everyone.
Basan,
there's one intervention very quickly.
It's me. I just wanted to say thank you to Dr. Chari. I thought his speech was absolutely inspirational. I was deeply moved by it. And the tenets, how right he is. If we all work in our space and finding a, solution, local solution, and we share our experiences, there's a lot to learn from there. So thank you, Dr. Chari, and thank you, Vasant. It was really fabulous. And also thank you to the Tejinder Sandhuji. Thank you for making a comment. Thank you very much.
Thanks, Ratna. I think let's now bring the conversation to a conclusion. Mr. Sharp, you have any final words of inspiration for us, please?
Well, no, I think just, again, it was really a fascinating discussion here. And I think what really is impressed upon me is how here in India, we see these models of both building resilience in the face of even unanticipated crises and moving the needle forward in terms of the SDGs and lifting people out of poverty. And to me, just one of the most kind of elegant examples is the response to COVID, where here we saw, on the one end, you see really cutting edge private sector business, pharmaceutical science coming together to develop vaccines and get those vaccines to market. And then on the other end, good old-fashioned community door-to-door work of the Anganwadis, of the Asha workers, lots of women on the front line, ensuring that children are receiving their routine immunizations and everything. And that whole chain in between, the digital public infrastructure, COVIN and such that we in the UN we're proud to help support. So, you really see that partnership, the entire continuum. The COVID response is a perfect, elegant example, but there's so many other examples that have been mentioned. So I think increasingly we're trying to take these lessons, both scale up here in India, but take those to the to other countries through South-South cooperation and other means. So I think I'll leave it at that, but very much inspired by the conversation. Thank you.
Thank you so much. Yeah.
So
Suraj, can we call it a day now? Yeah.
Yeah, I think we can call it a day.
Yeah.
And also, I think we have a nice topic for our next webinar, inspired by the UN Resident Coordinator's pointing of attention to the entire issue of financing, which again, under SDG 17 is also an important topic. And hopefully not exactly the Tobin tax, which we all remember from long ago. It was a non-starter. But I think there are some wonderful new initiatives, and harnessing the financial markets for accelerating progress on the SDGs might be an interesting area to take a look at. With that,
Sure.
I think we can sign off. Basant, you want to close the webinar?
Thank you very much, everybody. And see you all next month at the last Saturday of next month. Bye-bye.